A 61-year-old man presented to us asking for our help in improving his heart. He had refused 4-vessel bypass surgery after suffering a heart attack. He came to see us with a severely weakened heart. See what happened next. So Camille, tell us about this 61-year-old man with a very, very complex medical history and severe coronary disease and heart failure.
So initially, a few months before coming to us, he had had a heart attack, but he declined bypass surgery even though they found 4 severely blocked arteries. And so he was here to try to improve his heart more naturally. At the time, his heart was pumping at 25%, so that's very low and consistent with heart failure. And on our first initial testing, when he did our treadmill stress test, he actually had an acute event. He had EKG changes. We had to send him to the hospital.
Yeah, I remember that time. And, I looked at his coronary angiogram from when he refused surgery. And he did have very, very severe lesions, a weak heart. And at that time, seeing for the first time him presenting with an acute event, I actually tried to encourage him to have a coronary angiogram. In situations where individuals are in the throes of a heart attack or potentially progressing toward a heart attack, that's a situation where an emergent coronary angiogram and a potential intervention is really warranted.
We started immediately a plant-based detox. We met with the chefs in the garden kitchen to come up with an individualized meal plan and food recommendations for him. And we also recommended ECP therapy to improve angiogenesis, collateral blood flow in the heart, and improve his exercise abilities. And then we also recommended both of the IV interventions we do, like the chelation therapy, which is a molecule that can help pull out heavy metals and calcified plaques and has been shown in some studies to lower rates of heart attack and stroke, especially in people with both diabetes and heart disease. And then we also did some IV interventions of a molecule of phosphatidylcholine that helps to stabilize the artery wall and remove fatty buildup.
So this is a very aggressive approach you took. Again, it was someone who had multiple vessels that were diseased, one that was critical to the point where it probably caused a previous heart attack, may have permanent risk for a second heart attack, but he refused. So we had to give him everything we had, first and foremost, to reduce the inflammation. So someone who comes in who's at risk, you don't open the arteries up immediately, but what you want to do is you want to stabilize the arteries. Think of the arteries as being on fire, that biochemical fire that we talk about with inflammation. And so you have an artery with a plaque that's, maybe you've got platelets trying to close up. And so the anti-inflammatory effects of the diet, the target supplementation, the inflammation, those things stabilize that. It's like you have little biochemical entities going in and spraying down the fire. The target nutritional regimen you put them on, plus the other things, can reduce inflammation on a matter of hours to days. So we do know that we got him to a point of stability, certainly within that first week and definitely with that first 4 weeks. So that was great that we hit him with everything at once and he was cooperative with that. So how was his clinical course after that?
He underwent these therapies for about 3 or 4 more months, but then when he was back at home, he had another event, severe angina. He had to go to the hospital.
They transferred him back to our service. And, that again made me concerned. Did he regress on his diet some, etc.? It's hard to say. He was actually pretty compliant and worked very hard, but he also had very severe disease. So I remember transferring him back to our service, and within 24 hours of being on my service in the cardiac IMU, overnight they called me and said that he had an event called ventricular tachycardia, and the nurses had to shock him out. That's a life-threatening event. So just imagine if you've seen the medical shows and someone goes into what's called cardiac arrest and they rush over and have the paddles and shock them. That's what happened to him. At that time, I said, look, you need to go to the cath lab. So he went and had an angiogram, and it showed a pretty significant lesion in the front of the heart. So he received a stent, and after that, he felt much better. So he was hospitalized, but the other vessels we showed on angiogram had improved from before.
About 1 month after that intervention, he still was having intermittent angina. And then it really took about 5 months for his chest pain to go away. But during that time, his exercise ability kept increasing. So 5 months after, he was doing strenuous exercise without angina, which was a huge change and important to him because he didn't want to live in fear of me exercising is going to cause another problem.
Our approach is integrated. And so we use a natural integrative with nutrition, target supplementation, other therapies. However, we stay in touch with the patient, obviously clinically following very carefully here. And we utilize the allopathic treatments such as stent when needed or bypass surgery when needed. However, we don't use those things in isolation. The typical therapeutic approach in cardiovascular medicine is you come in, say the first time and we present it, get your bypass surgery, we're done, go home, we're going to talk to you about other interventions. And bypass surgery does not cure all the disease. It can hit a critical lesion that's targeted and fix that and help the overall picture. But you have to treat the patient comprehensively, regardless of whether you use those interventions or not. Because here's somebody who needed both. And not only that, after the PCI, he still wasn't totally normal. So things continue to improve with the nutrition, chelation, other integrative therapies, to where he then got to where he was, completely angina-free, able to do stressful exercise, and his overall health improved.
Over time, he continues to see us, and we were able to, over time, reduce some medications. He lost 93 pounds in 16 months.
Wow, but what, 34% of his weight?
Yeah, 34% of his weight, and all of his cardiac biomarkers, his cholesterol and lipoprotein A dropped a lot. And he really looks like a different person, and he feels like it now too. And like you were saying, the integrative approach is what helps really clear up all the arteries, whereas surgical intervention can only target certain areas.
So this is a man who went from needing bypass surgery, 4-vessel bypass surgery, to only needing one stent in one vessel. The other vessels are cleared up by the integrative approach and his hard work with lifestyle. But not only just the vessels and the heart, but other parts of his body. By that amount of weight loss and that amount of improvement in functional status, you can tell that this person was biochemically and physiologically better as a whole. So he was a new person. Oftentimes, if you just bypass the vessels or fix the heart, the rest of the patient gets lost in the shuffle. But this approach fixed the whole patient in total. So I think that's really the take-home message. I certainly hope that was helpful to you. And of course, if you have any questions or comments, leave them in the comment section. And we look forward to hearing from you. Until next time, take care.
Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.